Good evening and welcome back to the program. Really excited. I promised you earlier that we would have something new and exciting, and we do. And so really excited that CIS, Cardiovascular Institute of the South, has developed this new program. And first we want to introduce Angelique Shear. I could tell you all of your different initials. Donnie, Scott, and I tease each other about that. But you're the Chronic Care Management Team Leader for the Bayou region, correct?
Correct.
Welcome to the program.
Thanks for having us.
You got it. And next to her is Mr. David Domang, who is a CIS patient. Welcome, Mr. David.
Thank you for having us.
Oh, you got it. All right, so Angelique, people talk about chronic care management. It's kind of a new concept. Let's talk just a little bit about what it is. What is chronic care management?
So chronic care management is a new program at CIS that is relatively new. It is a Medicare program that they recently established to allow doctors to be a little bit more proactive in the care of their patients with chronic conditions.
Okay.
The program helps the patient by increasing that interaction with our patients and allowing them to have that continuity of care by a personal navigator, a nurse navigator, that's going to take care of them in this program.
And so it's really, it's new and in concept that navigators have existed, but you guys kind of take that to the next level in the program, right?
Correct.
Okay. So who actually needs chronic care management? Who qualifies for this?
So Medicare has said that if you have 2 chronic conditions or more, you are eligible to be in a chronic care management program.
Okay.
They have established over 90 diagnoses that they feel are chronic in nature. Some of these diagnoses are like heart failure, AFib, high blood pressure, hypertension, which is high blood pressure,
right.
Dyslipidemia. There's also, it goes beyond the cardiac diagnosis. It's the anxieties, the obesity, diabetes,
diabetic conditions,
COPD. So really the sky's the limit. There's multiple diagnoses that will allow you to be part of a chronic care management program.
And you guys kind of focus a little bit more on the cardiovascular aspect of those.
We do. We actually focus on really 6 main cardiac diagnoses, and those are coronary artery disease, AFib, hypertension, dyslipidemia, heart failure, and peripheral vascular disease.
And AFib is atrial fibrillation.
Correct.
Just so for people to know, you know, that's okay. Just want to make sure that they know that. So I am awfully impressed with your team, but tell us who's on the team for chronic care management. Who makes up the team?
So we have a compassionate chronic care team that consists of our CIS doctors, our nurse practitioners, these designated nurse navigators. We also have a licensed social workers and registered dietitian on the team.
Oh my.
Yes, our chronic care navigators, they are in close communication with the doctors, making sure that your care is taken care of and everything is done appropriately. You also have access to our virtual care center, which is in Lafayette. This is a 24-hour, 7-day-a-week access to our patients. They can call a special designated number that we give them anytime after hours, weekends, holidays, it doesn't matter. They can call this number and they'll get a CIS employee to help them with their needs.
So always connected.
Always connected.
Very, very nice. So let's talk a little bit about how the program works. Talked about who qualifies, what conditions, and who's on the team, but how does the program actually work?
So it's actually set up to be kind of like your one-stop healthcare shop for your healthcare needs. We work closely with each patient and we develop a personalized, unique care plan that addresses their needs and manages their care based on their medical history and their condition.
Okay.
The program, we communicate several different ways. We can do text messages, we can do, of course, a phone call, we can do video chat, and we also do emailing. This helps the patients, it gives them more ways to communicate. If we have some patients that they can't read, they can't write. They have all these medicines and all these bottles and they really don't know what's going on with their medicines. We can say, let's video chat. Show me your bottles. Let me look at the medicines. Let me see what you're on. So it's able to help us be able to communicate better with some of these patients and know exactly medications are a big issue, patient safety and all, making sure they're taking the right things. So it gives us that opportunity to go a little bit further with just a phone call. We can use different techniques that help us they can text us the names of the, family members can reach us that way as well. So it really helps the whole program itself, giving them more options as to how to communicate with our staff.
Okay, very nice.
We also, they get that, like I said, that designated phone number. They can call at any time for anything, worsening symptoms. I'm short of breath, this is not right, this is something new, let me call my nurse, in the hopes of we get to the doctor sooner, we get something treated at home, eliminating that hospital admit or even coming into the to the clinic. So it really helps a lot. Refills. you can call us anytime. We can get the refills ordered for you. As well as just need an appointment with a primary care doctor, urologist, pulmonologist, anybody like that. You have a hard time getting through. It's always, sometimes you can never get in, it takes a while. Call us, we can call there. As your provider, we can sometimes get you in a lot quicker, so it helps to get that as well too. So anything with our health care, they can call us and we help assist them in their needs.
And so you're navigating their care, but you're doing it through ways that are convenient for the patient, depending upon their individual needs.
Correct.
Very nice. Now, speaking of that, individual needs, we talk a little bit with Mr. David Domang, CIS patient. And so when and how did you begin using this chronic care program at CIS? When did you start doing that, Mr. David?
I think it was about, we were discussing this earlier.
Right.
We were trying to figure out when it was. So let's go back like a year.
Okay.
And we had been talking about a few things that I had been in touch. I came across Angelique through the CIS team.
Right.
And I'm not exactly sure and don't remember how we came upon each other, but I needed some help.
Right.
And to help me with, well, it's been several different things, prescriptions, appointments that I needed to reschedule and that kind of thing. And she offered it, she had worked with me to help me through one particular problem. And not too long after that, she said, we have this critical care management. Would you be interested in joining in with it? I said, well, tell me a little bit about it.
Right.
And so she explained it, and I said, well, that's what you're doing now. You know, so
they had already really started it, right?
Yes, it was underway, and I guess she thought, looking at my
medical history,
right, that I would qualify.
Okay.
Now there's some blood pressure issues and there's some heart disease going on, but I've always felt like I've been in really good hands with the CIS team.
And now they're in more communication with you about it.
A lot more.
Okay. Speaking of, how do they do that with you? How do you communicate with the team for you?
Angelique and I have a direct line.
Okay.
And thankful for it.
Okay.
And I've had to communicate with her on several different occasions, and there's been a couple of times when I've talked to her 3 and 4 times a day.
Oh my.
To make sure we're on the same page for something coming up and changes made or things like that. So, and this is regarding upcoming procedures, appointments, blood work, all of that.
Okay.
Like she mentioned before, it is a one-stop shop that helps you collectively make sure that, and it gives you time to think about it and make sure that if there's something you're missing, all you got to do is give them a call, text them, send them an email, and if Angelique is not available, somebody's available.
Somebody's always available.
I may talk to somebody in Lafayette, and I'll say, look, I generally talk to Angelique, but this is what's going on, and it can wait, or whether it can or not.
They help you figure that out.
Will you get a message to her and have her get back with me as soon as she can?
Right.
And we'll go from there because she's up to date on what's going on.
Sure.
It's a great program for people like me who have special needs from time to time that needs attention.
Well, I'm glad you just answered the question before I even asked it, which is how do you feel about it, which is good.
I love it.
Very good.
I love it, and I'm glad to have it. The whole organization, CIS, is really a well-oiled machine.
And it's gotten better with programs like this, and so I can appreciate that. Well, thank you for sharing, Mr. David. I appreciate that.
Okay.
Now, Angelique, going to look back to you a little bit, and Mr. David touched on it, but let's talk about the benefits of the program. What do the patients actually benefit by being on the program?
So they get a better manage of care while keeping you at home, keeping you out of the hospital. That is our number one priority with this program, is especially our heart failure patients. They have, a lot of times they're in and out of the hospitals. They want to be home.
Right.
You know, they get to the point to where they are calling the ambulances coming because they're so short of breath. And we figure if we can get to them sooner, like I said earlier, we can start that treatment at home. Hopefully by increasing medicine, we can prevent them from ending up in the hospital.
Okay.
We also are able to communicate more with them.
Right.
By communicating more, we're improving that overall care coordination and their quality of life. We're keeping them more healthy. We're keeping them out there to where they can live a quality of life instead of just being stuck in the hospital, in their house, and not being able to get out and about in the community. once again, like we said, the text messaging, the video, the emailing, it's just quick and easy access for some of these patients. I have one patient in particular that we email all the time, and that's most of our communication.
Okay.
And that's the way he likes it, and it just works out well. I get everything I need through there, and it's easy and convenient for him. I can go ahead and send him his labs through an email. I can do whatever he wants, and he enjoys that. So there's so many different ways that we can communicate besides just a telephone call.
Okay.
You also get less travel to the doctor. We're talking to you at home. We're hopefully, by keeping on top of you throughout the month, less time you need to come into the doctors. We are eliminating that ER visit once again, so your travel time is less. We also go over frequent medication reviews with the patients.
Right.
You know, that
That's
patient
the big
safety.
thing.
We want to make sure they're taking what they're supposed to be, and they go to one doctor, they change it, then another doctor changes it, and they don't know, and they have all these bottles of medicine. So trying to keep up with that and making sure that the medications are accurate and right.
Okay.
We also, continuity of care, you are designated that one nurse navigator. She takes care of your health care through your whole time here in the chronic care management program. You're not talking to one nurse and then another nurse and then somebody else. You
Right.
have that one person that is devoted to your care, and she knows what's going on with you, so that continuity of care is a big plus with being in the chronic care management program. And of course, there's the cost-effective option to better manage your health care. You know,
Sure.
if we can keep you out of the hospital, we can keep you out of the ER, we can even keep you out of the doctor's office. We're saving you money by having these.
Conditions managed at home.
Exactly.
Okay. And you already talked about the conditions that are inclusive in that. You went over all of those. But who can be enrolled in the chronic care management program
So
at
as
CIS?
far as CIS, chronic care management program, like I said before, we're looking at those 6 diagnoses. So anybody
Right.
that has 2 of those diagnoses are eligible to be enrolled in the chronic care management program.
Okay.
Now, of course, if you have something that's different, valvular disease, there's different things that we can look at that will make it chronic. It's not just cerebral vascular disease, strokes, things like that. We can
Okay.
also identify them through there. These are just a few of the heart diagnoses that we fix. We're looking to enroll, but like I said, if you have those other conditions, you're eligible, and we can definitely go ahead and get you.
Okay.
If at any time you can request to be put into the chronic care management program, the only thing is Medicare says you have to have been seeing your provider within 1 year.
1 year,
So as long as you've seen your cardiology in the last year, you're eligible to be enrolled if you meet the 2 chronic diagnoses and you're a Medicare patient.
And there's no cost, correct?
Well, it depends on your insurance.
Oh, sorry, right.
Yes.
Small
Medicare,
monthly fee sometimes.
Right. Medicare will cover 20% of the cost,
Okay.
which leaves, 80% of the cost, which leaves 20%, which averages around $8 a month.
Okay.
Now, if you have a secondary insurance, your secondary, depending on what type of plan you have, they may cover that $8, so then it may not cost you anything. So
Okay.
it really just truly depends on your insurance. But you have to keep in mind that the small monthly fee can help reduce the need for that regular visit copay. You might have to pay $30 every time you come into the doctor.
Right.
Well, if we eliminate all those extra visits, then that $30 goes to that maybe $8, so where you're actually coming out a little bit cheaper.
saving a little
The
money.
emergency room visits that you have to pay for, your hospitalization in general. So it's
Much
making it more
cost efficient.
convenient and cost efficient for the patient to help manage their care from home, and that's a big thing. You're at home, we're managing your care, taking care of you, and hopefully making you that quality of life.
We only have a few seconds left. Mr. David, you want to say something else?
It's a cost savings and keeps you up to date, gives you time to think about things that you might want to discuss.
Okay.
It has saved me money in times where I would have had to have an appointment to see the doctor.
And-
It saved me a lot of money.
Very nice. And so if people are interested, they can either speak with their physician or they can reach out to you, and the chronic care management number at CIS is?
985-876-0300.
Or
you can go online, www.cardio.com, and you can go there to the chronic care management program section and look us up there.
fantastic. Angelique, cannot thank you enough for coming on to share
Thanks
with us.
for having us.
Mr. David, thank you for sharing your story.
Pleasure to be
We
here.
appreciate it. All right, guys, that's going to do it for this segment. Don't go anywhere. We have an interview with Dr. Nair when we come back.